Okay, it is 5:01. We're going to go ahead and get started. This is the final public budget hearing for the hospital district. We will hold that meeting first and specifically relative to the budget. Then we will close that meeting and then we will start our regular monthly meeting. Pastor Moore could not be here tonight, so we are going to turn it over to our friend Barb for the invocation. Thank you, Barb.
Heavenly Father, let us pray that you will help us establish our steps in the decisions we make today for the health needs of our community. We pray that the trustees will seek you for advice and that our decisions and our actions will be based upon your wisdom. Please guide us, Lord. We place this meeting in your hands as well as our hearts and our minds so that you may direct us. We ask this in your name, we pray. Amen.
Amen. Thank you. Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm going to turn this over to our treasurer, Michael Kent.
Thank you, Madam Chair. Item 4 on the agenda is a review of the September 5th, 2024 public budget hearing for fiscal year 24-25, the millage and budget. Step 1 is to discuss the percentage increase in millage rate over the rolled back rate. On September 5th, 2024, the Board of Trustees tentatively approved a proposed budget for fiscal year 24-25 with a millage rate of 0.7650. The 0.7650 millage rate represents a millage rate increase of 61.39% as a percentage of the rolled back rate and will provide the district with ad valorem tax revenue of $22,445,137. This is an increase in the ad valorem tax revenue of $8,871,832 over last year. Item 2 is to discuss specific purposes for which ad valorem tax revenues are being increased. I've got just a handful of bullets that I will go through quickly. The Indian River County Hospital District plays a critical role in improving and enhancing community health and well-being by providing care to vulnerable populations, including low-income families and the elderly. Investing in primary and preventive care is a proactive approach, and it can reduce the need for more expensive emergency care in the future. Our county is also experiencing significant population growth, which directly affects the demand for healthcare services. Coupled with ever-increasing costs of healthcare, including the cost of medical supplies, staff, and facilities, this proposed budget is necessary to keep pace with those rising costs and to maintain the quality of care that all of our residents expect and deserve. A couple of specific examples of those increased costs, as well as increased need, are, in the last 10 years, demand for essential primary care services has required a surge in district financial support from $277,000 to $3.15 million. Also, the demand for mental health services has grown significantly, with district funding increasing from $664,000 to $4.2 million. Although there was an increase of $2.6 million in program expenses in this proposed budget, I'll note that we received over $20.5 million in funding requests. Through the diligent work of all the trustees, we were able to pare back out of that a little over $1.6 million. And I will point out again, I didn't use the word, but I'm going to use it now, inflation has had an impact, significant impact on all of the organizations that the district funds, as well as on the administration of the district itself. And lastly, in responding to all of these needs, as we have done in the past 2 years, we will be utilizing some of the district's reserves to cover part of the increase in expenses in this proposed budget. More specifically, in the past 2 years, the district has tapped approximately $4 million from our reserves. The third item, under number 4, is to listen to comments and field questions from the public. So at this point, I will ask if there is anyone in the public that would like to speak on the issue. I see a hand. Please come forward to the podium. The microphone's on. Give us your name and address.
Hello, I'm Susan Chenault, and I live on 48th Avenue here in Vero Beach. And I wanted to attend tonight to thank you all. I specifically would like to thank Michael Kent, who about a year ago asked me if I was willing to be a volunteer participant on the Finance and Audit Committee for the hospital district. I am confessing that I knew very little about what the hospital district did and was somewhat intimidated by the ask, but it's hard to say no to Michael. So I showed up, and I have spent the last 11 months learning a great deal and feeling very fortunate to live in this county and to have you all serving this county. This is money that is local, that helps our own residents. It's not from the state or the government who doesn't know us, know our needs, or care about us. And so I never thought I would stand out loud and say I'm glad to see an increase in any tax, but I am very grateful that you all thoughtfully and carefully looked at this budget and presented this. And I am very happy to have learned what I've learned, and I would suggest to anybody who wants to learn, you all have a great website, which I've explored in depth over the last 11 months, and I feel a little better about sharing your work with the community going forward. But I'm just here to thank you all for the great job that you do, and to say I'm all in on the tax increase.
Thank you.
Thank you,
Thank
Susan. That was unsolicited. She's a friend, but I didn't ask. Any other comments from the public? Or on Zoom, thank you.
My name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and Susan has encouraged me by her fortitude coming to the podium. I, too, never thought that I would come up here freely to say thank you for the tax increase, but as recipients for some 30,000 individuals that come to Treasure Coast Community Health every year, know that we could not do it without you. It is a huge undertaking that our staff willingly embrace every day to make our public healthier. But the reality is it's darn hard work, and it's getting harder. And this has been a very tough year for finances, both individually and corporately. And so least anybody think that we are all government supported and you're just the icing on the cake. I do want to clarify that it's a very small part of our budget that comes from the federal government, and it pays basically for the board-certified physicians and dentists and mental health professionals that work on the community's behalf. And so, again, I say thank you from the bottom of my heart and everyone that we serve.
Thank you, Vicki.
Thank you, Vicki.
Thank you for the good work that your folks do. Okay, it's important.
Amen to that. Anybody else in the room or again on Zoom? I don't know who we've got on Zoom. Okay. Moving on to number 4 and 5, actually, unless there are changes to be made, and I don't believe that there are, we won't need to do any recalculations, and we're going to move forward on to item number 5 in the agenda, which is the adoption of fiscal year 2024-25 budget resolutions 2024-03 and then 2024-04. Number 1 under that is to adopt the millage rate, which is laid out in resolution 2024-03, which was included in your packet. At this time, I ask for a motion to adopt this resolution, which would establish formally the millage rate of 0.7650.
Second.
We've got a move and a second. At this time, I will ask for any trustee discussion, if you'd like to comment. I'm seeing none. I will then ask for any public comment or Zoom comment. Okay, at that point, I'm going to call the question. All in favor of adopting Resolution 2024-03, please say aye. Aye. Opposed? It's unanimous. Number 2, we're going to adopt the overall budget in Resolution 2024-04, again included in your materials. I'd like to have a motion to adopt that resolution, please.
So moved.
I heard 2 moves. One of you want a second? Bill seconds. And again, trustees, is there any comment that anyone would like to make?
I would like to make a comment. It appears as it's a large increase, but the need is growing so great in this community. And I guess I would just like to thank the trustees for believing in themselves and believing in this community and being there to really help this community and feel good. So I'd like to just thank the trustees myself.
Thank you. Any public comment? Or on Zoom? In that case, we'll call the question. All in favor, please say aye. Aye. Opposed? And that is unanimous. My last duty on this agenda item, or in this public hearing, is to announce publicly the percentage by which the new proposed millage rate is greater than the rolled back rate. And that millage rate, as a percentage of the rolled back rate, is 61.39%. With that, I'm done with my part of the...
Any other public comment? Hearing none, we will adjourn the formal final public hearing for the budget for the Indian River County Hospital District.
And then you've got documents, oh, they're right
These,
there.
here they go. You can pass these down to Barb for her signature. Okay, we will now open the regular monthly meeting of the Indian River County Hospital District. And we will start with the consent agenda. If I could hear a motion for approval of the chairman's meeting minutes dated August 26th and a September disbursement of
$1,471,899.66.
So moved.
Second?
all in favor?
Aye.
Thank you very much. Again, I just want to say that, you know, the budget process is getting better and better. It was a little tricky this year because of moving to the EC impact and that type of thing, but I think we moved through it in agreement, and, you know, again, thank you all for getting through that. I'm going to turn that over then to Jennifer.
Okay, thank you, Madam Chair. As always, I've responded to questions from each of you as they've arisen this month pertaining to the various matters the district is handling at the present time. I've worked with you and answered questions about this budget process that we've now concluded successfully for this year. Continue to review our annual deadlines and deliverables due to the district under the lease with the Indian River Cleveland Clinic, and have responded with questions as they arise. And I'm working on a few projects with regard to some requests about some information and summary of kind of the authorities we have under the lease so that we can get that into a summary form. I think it'll be useful for the board members now and also for some new board members that will be joining us in January. So working on that. As you are all also aware, under the leadership of our trustee Karen Deagle and our executive director Frank Isley, we have been continuing to negotiate to purchase a property to house a future women's sober living program. We are making some really good progress in this regard with the county, getting answers about the zoning that we're going to be ready to bring forward back to you shortly. We also have been studying the title work and working with the seller who is willing to assist to answer some of our questions on the title work. And then when we have a little bit more information, we did just have a Zoom with them again this afternoon. We'll look to bring something back before you more concrete with a solid recommendation so we can hopefully go to contract with your permission and consent, of course. We have come to a lease agreement with VCOM to lease the Human Services Building, I believe, beginning October 1st. Frank circulated some correspondence to that regard to each of you after yesterday's meeting. And we are just really looking forward to finally having that building occupied again. The last piece, as I mentioned at our meeting yesterday, I am working with Hospital Council just to paper the hospital's waiver of the right of first refusal they hold on that parcel that's derived from our 2018 lease as amended, which they have freely agreed to waive. I'm just waiting on getting the language from council, and then I will review that and circulate that once again for your review and information so that that matter is fully complete. And again, I continue to work with Jennifer Frederick as she gets updates and things from our funded agency contracts so that all of these things are papered properly as we are going through this funding cycle. So that'll be a little bit of work that she and I will continue to just finalize, but really, she does most of that and just gets me completed copies, and we've really advanced that as well this year using DocuSign and just all the technology in the world that is making it just easier. So I really appreciate that. And also continue to participate in your strategic planning efforts as we continue to work towards accomplishing those goals and finalizing that plan. I think that's it. It's been a busy month for me and busy couple months for the district.
On the VCOM issue, we did, Frank did send that around about approval for a change, but we will take an official vote tonight to be able to do that for the record, okay? Before I sign anything. So we'll do that under unfinished business.
Does anybody have any questions for me on my report? I didn't ask that. Okay.
Okay, hearing none. Michael, you're back on.
He's back. 11 months into the fiscal year, I'm happy to report that the hospital district's financial condition continues to remain strong. And as we've done for the last several months, let's turn to the last 4 pages of the financial report that you received in your packet, which include the year-to-date expenses versus approved budget and Mr. Isley's financial snapshot report. And actually, as usual, let's start with that last page. The snapshot focuses on the district's investment in cash holdings. At the top of the report, it shows that, I've got my notes at the end of June, that would be at the end of August, sorry. At the end of August, the district had received $12,946,443, which is 102% of our budgeted tax revenue. If you look at that second note under that section, it explains why we're over 100% for this fiscal year, and that's because, you may remember from our last meeting, we got back tax payment of $306,000 plus that we received from the county. That was unexpected, and it covered like a 17-year time span. But those dollars obviously brought us up. I did the math. If we backed out those back taxes, that $306,606, we would have received $12,639,837 in this year's tax from the county, and that equals 99.6 of the current year payments and of that budgeted amount, and that's very typical of where we land, sometimes over, sometimes just under. In fact, there's one more month, there could be a few $1,000s that still come in. In section 1 of the snapshot, it shows that our laddered treasuries there, as they always are, total $6,860,182. Section 2 shows that we also have $4,854,387 in the Florida Fixed Income Trust. That's the money market account. And with both those listed T-bills and the money market, they carry very solid interest rates. We've been very fortunate for the last couple of years with the interest rates that we've been able to take advantage of. We're going to start to see those rates starting to drop somewhat. You know, nobody knows what's happening for sure, but I think we know. And clearly, though, the district is still going to continue to receive significant interest. We're in a good situation there. So we'll just monitor those interests and kind of report on those as we go. And then section 3 of the snapshot shows the status of our local operating accounts, which is holding say it all, $1,546,577 at the end of last month. And altogether, those total $13,261,146 in cash and investments. If you flip back 3 pages, and I'll ask if there are questions on that page. Okay. Having that sheet is so good. I mean, there are, we get very in-depth reports from Deep Blue, but when Frank pulled that together, it helps. It just makes it easier to follow. If we go to those other pages now, this is the year-to-date expenses versus approved budget. Please note at the top of the second and third columns, as I said, we're in the 11th month, and if everyone received even monthly expenditures, and of course they don't, that budget expense for all of them would be 91.6%. As you scroll down through those next 2.5 pages, you'll see that almost all individual programs and agencies are in the vicinity of 90%, some a little behind, some a little ahead. You'll also see that we have 3 funded agencies, which are over 100%. They're Whole Family Health, Senior Resource Association, and Sunshine Physical Therapy. And as you know, these agencies have exceeded their budgeted amounts here in this report because during the course of the fiscal year, they came to us and they requested and received from the board additional funding. Excuse me. On page 3 of this report, you'll see that the totals for all program expenses through August was at $14,623,339, which computes to 89.7% of the total program budget that we approved almost exactly a year ago. The bottom half of this page shows our administrative expenses. Again, several are high, even over budget. We've explained these over the last few months. We know why. And you'll see that total admin expenses at August were $1,206,767, which is 102.7% of what the approved budget was. Now, combined, administrative and program expenses for 23-24 as of August, end of August, is $15,830,105, and that's 90.6% of the budget. As a point of comparison, at the end of August last fiscal year, our expenses were at 79.7. And by and large, I will answer questions if there are any that you have, but with that, I'm done with the prepared remarks I have, Madam Chair.
Any questions for Michael? Okay, hearing none, we will go on to the funded agency report, and we have what, there's a question?
Executive Director.
Oh, the executive director, I'm sorry, Frank. I'm sorry, I came right into there, okay, Frank, it's your turn.
Thank you, Madam Chair. VCOM is wonderful news. Jennifer already spoke to that, but they're going to be great partners to work with, and just wonderful to have them in our community. A follow-up item on CEFBEN and DCF. If you remember, I've been talking about this for the past couple months. There was an abrupt funding cut that impacted preventive care programs to 3 of our agencies, to the tune of about $80,000 for the rest of the fiscal year between half of July through the end of September, but then a full impact of about $321,000 for the next fiscal year that we're working with community partners to come up with a collaborative solution to support those important programs. But I had reached out to Senator Grallen-Brackett's office. They were responsive. And I did get a response, actually, from someone at DCF, and this is hot off the presses, just came to me today. The response is not what I expected. I expected a probably much greater level of detail. I had sent her the letter that I had initially sent DCF, and I had sent to Senators Grallen-Brackett. She didn't have a lot to share. She was responsive, but there's just not a lot of meat in this email. The long and short of it is, just to summarize it, is that the funding that we knew was going to be available for a limited time. It was supposed to sunset, though, September of 2025, but it was cut off to the agencies mid-July of 24. But it was not something that, from what I'm reading, they felt was necessarily need to explain. They're not calling it a funding cut, saying they were federal discretionary funds and time limited. However, it was much shorter than the time expected. So that's really it. I don't have any more answers other than that at this point.
What did Representative Brackett and Senator?
They were supportive. They were supportive, and I spoke to their aides and explained that, and they were going to reach out to DCF also. But I explained the situation. I had sent them the correspondence, so they had an understanding of the detail around what was going on. And the goal of reaching out was just to see if we could assemble some facts to understand what happened. When money comes in from the state and it goes to our managing entity and it's stopped, the managing entity never gets it, and the state stops supplying it a year plus in advance. Why? And I think it's reasonable for us to get an answer why, and the agencies to get an answer why. Unfortunately, at this time, still don't have an answer why.
So are you going to send that response to?
I am.
Brackett then? Too?
I am. I just received it.
And just basically, that's not really an acceptable answer.
Agreed. The responsiveness was great, but the answer was just, it didn't have any detail. Just quick on Sebastian River Medical Center. Everyone is watching, and it's been in the news that it seems like the sale's going to go forward with Orlando Health, but this is not a done deal yet, so more to come on that. Inpatient detox, I did get an update from Cecilia, and I'll just read it to you. So what they're doing is they're in process of finalizing the substance abuse licensing application, and they're aiming for submission shortly. They're working on their business plan to prepare for the population that they will be caring for. And they've purchased evidence-based curriculums and started specialized clinician training while coordinating nursing and behavioral health technician education. So last, they're working with our psychiatric service, the Cleveland Psychiatric Service provider, to secure a psychiatrist specializing in addiction medicine. So we're making forward progress on that. It's going to continue to take some time. So.
What's the scope of, what are they going to be able to?
8 beds.
Okay, that's what I was.
So that's what we're looking at, is 8 beds, which right now is better than 0.
Amen.
So
Yeah.
we will start with 8 and see where we need to go from there. So that was the thought behind that. I'm going to ask Caitlin now to just kind of walk through. So I wanted to speak to something that we're going to do next month at our October meeting, and then going forward. I think it's really important we do 2 things. Number one, at the next meeting, I have a follow-up to share with everyone based on our strategic goals that we've had in place for the past couple of years. And so I worked with the team, and we have a list to support the goals, so we can just close the loop on the goals that we've had in place since '22. And then starting at the October meeting with our new strategic goals, we are going to report on our progress on those goals on a monthly basis. So that's going to be a standard part of every report I do. And then we'll have supporting data through Caitlin's support. In addition to that, Dawn is also going to provide our performance review metrics and goals we have to hit over the next 5 years. Now, some of these are going to take a lot more time, but we want to make sure at every meeting we provide a solid report on those 3 things. Okay? So Caitlin, maybe you can walk through this new web integration you've done, please.
Okay. All right, so we have the dashboard up on the website now, so let me minimize these. Okay. Okay. So obviously this is our home page for you guys to know where it's located. It's under the impact tab, and then down here in healthcare needs in Indian River County. So if you click on that, and it's loading, it's already just embedded into the website. So if you ever want to look at it, it's right there. You don't need to go to any special links. It'll just be on the website. And then these are all clickable tabs, so you guys can scroll through, pick what area that you want to look at. And so for today, instead of going through the whole thing, since that would take a little bit, just going to go to the things that get updated on a monthly basis.
Perfect.
which is pretty much just gonna be all of our fee-for-service information, since we get invoices every month with all of the visit numbers and that sort of thing. So every month I'm updating how many visits we see, broken down by which agency. We've got the total for the year so far, for the fiscal year. And then these will let you pick what organization if you want to focus on, or what service. So if we can just look at behavioral health visits for the year, or dental. So you can break it down that way, or by agency. So I'll be updating this every month. And then this is another page. I can also, here, I can zoom this in if that'll be better. This is in the way. Are we able to move this thing? Hide floating, okay, sweet, okay. All right, and then this is the other page that's gonna be updated every month. So we've got the active amount of portal members, how many patients are there. And something new that I added was the Medicaid enrollment, because I thought it would be interesting to look at the comparison of how many people are on Medicaid versus how many people are in our portal. And you can clearly see this is right around, that's like exactly when everyone started coming off of Medicaid. And you can see the sharp drop, and then as that dropped, ours started to go back up. So I think that's really interesting to see. You know, it explains why we had the drop, because so many people were staying on Medicaid that otherwise would have been in our program. And then over here, it's also the amount of applications we're receiving every month. So you can see which months we're getting more, which months we're getting less. And then lastly, this graph shows how many people we have that are active versus how many people actually went for a visit that month. So the percentage of patients that are actually going in. So you can see that. This technically does update every month as well, because it's pulling the data off of whoever is currently active in our system. I don't really expect it to change too dramatically, but this will update every month with whatever the current demographics are of our portal as well. So that's pretty much it for the stuff that is going to be updated.
Way to go.
Thank you. Any
So thank you for that,
questions?
Caitlin.
Yeah.
One of the things that, you know, we're doing a lot of now and laying the groundwork for is all our data-driven decisions. So, you know, these data will help quite a bit, and we have some additional data points to talk about too. I'm just going to mention it briefly, and maybe, Caitlin, you can give a 2-minute update. So, health data collection from Indian River County residents. One of the things we want to be sure of, there's lots of data that's available in our county. It's available at different intervals. It's available every 2 years, every 3 years, every 4 years. In some case, our screening data hasn't been available since 2016 for how many people are going for preventive health screens in our county. What we'd like to do, and we had spent over the past couple months, Caitlin arranged and we interviewed a few different companies who would do surveys in our county. And we wanted to make sure, at least on an annual basis, we had solid data points that are consistent with the goals that we're trying to support in terms of making an impact for access and affordability for everyone in our county. And so we have, you know, so we've worked through that. We've secured a list of questions. Remind us of the name, Caitlin, that we chose for.
For the organization, they're called Clearview Research. They're based out of Tallahassee. I
Yeah,
believe.
United Way had, very professional, United Way had recommended them, someone they had worked with, and very impressed by them, especially in the healthcare space. So, we've been working with them on a question set that is going to be, we can complete the survey in 3 days. We'd like to do the survey in October. And those survey questions, we'll of course review with the trustees before that. And we'd like to move forward with that. So once a year, we're going to have some great survey data from Indian River residents in a representative sample throughout our county.
How are you going to throw that to the public to have them do the survey?
Well, it's not, so it's the survey company we're using is, they call. So within 3 days, they call enough people to generate 600 sets of responses, which is representative sample of 167,000 people in our.
Is this pretty much finalized, or you're still working
No, we haven't, we haven't finalized anything. I wanted to make sure the trustees,
on it? D5 with the insurances, you might
Yeah.
want TRICARE.
oh, okay. That's a good thought. Yeah, especially with our veteran
Gotta look
population.
through these.
Yeah,
Yeah, I do want to also say they are coming, or well, over Zoom, they will be here for the October chairman's meeting. So if you want to have any questions with them, they will be here to answer them.
We wanted you to meet them.
Yeah.
I knew Michael knew them, but I didn't know.
Yeah.
Could we see a copy of the proposal from them?
Absolutely.
I'd like to see a copy for the ones that you looked at.
Sure, absolutely. Caitlin, can you
Yeah,
send those to the
I can send
trustees,
those all
please,
out,
three?
yeah.
Thank you.
So thank you, Caitlin. The last item I had on my list was just, I wanted a follow-up item for, well, it's a new item here, but it's something in progress, is mental health court. So we convened all the parties that play a role in our mental health court service that we support, which is tremendously impactful in terms of prevention and getting people, in a better direction with their lives to be, living and working and successful in our community. It's been a very successful program in our county for some time, but we've been funding it because, like some other programs that I've just mentioned, the funding for these important preventive programs have stopped. So one of the things we wanted to make sure we understood is the totality of this program, and thankfully, Vicki and Treasurer Coast had jumped in to assist with this program. There's so many stakeholders in our community that play a role in this program, but truly understanding the flow has been a challenging thing. So we did have a meeting. We had a preliminary meeting with all parties a couple weeks ago. We have another one scheduled, I think it's October 22nd, to bring everyone together and really walk through the detail and make sure we fully understand it so we can make sure we deliver the service as efficiently as possible. So that's the goal of that, and have the optimal impact for those in our community who are part of that program. That's all I have. Any questions?
Could you tell us a little bit more about the grant writer that you're looking at?
Sure, I did. So one of the things that I had learned maybe 4 months ago, was that I honestly didn't realize this, was that as the district, we can apply for grants. So I wanted to be sure we put money in the budget this year to look into that in further detail, to see if we could secure someone to go after some of the available grants. There's hundreds of millions of grant dollars. How much of it we will secure, I'm uncertain of, but special districts are eligible to apply for several grants. So I want to try to optimize our grant funding, and that's the reason behind that.
Unknown by me, number 5 on our agenda was exactly what I had in mind. And I had called Frank, and my thinking was exactly what he's contemplated. We don't need to hire somebody, contract with somebody, get our feet wet. I'm thinking federal, state, private, with an eye toward our funding partners to make sure we don't create issues there, because we may be drawn from the same pools. But see how that develops, and eventually possibly have somebody come in that would not only be a resource for us, but be a resource for some of our smaller entities that could use the help and expertise. But at least the first step, contracting with somebody and see what it can do for us. And I suspect, like for instance, our women's detox facility, it would not surprise me that there aren't specific grants out there that we could find that would help us quite a bit with that, and a couple of the other things. So, and building programs at our hospital in conjunction with Cleveland Clinic, even, some grander scale things that we might be able to access a little more readily than Cleveland Clinic or some of the others are. So,
You said one critical thing, and some things everybody's in the pool for, and we have to be real conscious of and deliberate about if we step into one that some of our partners are
I will
taking
say,
or have
Michael,
been funded in the past from. We don't want to dilute what they might.
with the grants I looked at, They were not. There are pools of grants that are district-specific. So those are the ones that I saw first when I started
Yeah.
researching.
Exactly.
I like that idea of focusing, because we start to run a slippery slope if we're looking at private foundations, because that is philanthropic, those are philanthropic dollars, and that's not our business.
Right.
So
Well, there might be some large private entities that are national that we haven't even, that nobody in our county has bumped into, that we, in other words, so, and I would, as part of the program, give license to our funded agencies to be very outspoken if they felt like we were stepping on their toes, because I think it's important we keep those relationships strong and good and trusting. So, getting something started with a contractor, focusing on federal and state, and see whatever else is out there being program
I
specific.
understand.
Yeah.
I want to make sure that we're all on the same page as to the purpose of this and the priority, because we can spend a lot of money on a grant writer. And so I want to make sure that we're really careful with that. And let's focus, my preference, I'm comfortable with the federal that are specifically for special tax districts. Great start there. And then go from there.
Good. Okay, thank you. That's all I have. Thank
I
you.
have one question, Frank. Maybe you could give us a further update on Cleveland Clinic's community health needs assessment, the date of that, and was there a role that Indian River Hospital District played in that process? Are you aware?
I think we can play a much larger role in all the community needs assessments that are done in our county. I don't know to what degree we were involved in those in the past, but I haven't seen our name on any of them. But I think, it would be wise for us to participate. We'd be more than willing to participate, especially with the knowledge base and experience that we have with the district team.
That's what I was
So early on, we did, actually, we're the coordinator between the hospital, and TCCH was part of that, and the health department was part of that, because they were all contracting with different people, and in order to be more efficient, if you would.
Yeah.
And it fell apart.
I think part of the problem was that each entity had certain things they had to report.
Right.
And it was becoming convoluted or difficult, whatever word you want to use, to have just one study done.
Right.
And that's when we say it I don't know if it fell apart, but they broke
Well,
away.
it broke away because
away.
they had their focuses
That's right.
that they needed to have. And so while the intent of the meeting that is out there in October, I think it's the 22nd, I did send that to Kate. But the intent of that is to show their initial findings and then be able to have conversations with community leaders about what they think about it. Which is part of the health needs assessment process. They have to do that.
Well, I hope they will compare their 2021 community health needs assessment with where they are today and see what we've accomplished. As I read through it, I don't see a lot actually being accomplished during that 3-year time frame. COVID was in the middle of it and so on. So it's a very difficult time to look at your community needs, but that's something that I'm delighted to see the district is really concentrating on, is looking at those community needs.
Absolutely, and I foresee a lot more collaboration, partnership, working together, making data-driven decisions. And when we get great data from the survey or perhaps other studies we do, we share it with the county, we share it with the team. It's really important, I think, for us all to be looking at the same data. And if we're doing the same study, we're getting different data, we need to talk about that too. Because we have to be consistent to address the issues that we need to address in the county.
Thank you.
Thank you.
Okay, now we'll go on to the funded agencies, which is Senior Resource, and it's Robin, welcome, and Liz, are you taking the lead, Robin, or is Liz?
No. First of all, thank you for inviting us to speak this afternoon. I am Robin Orzel. I'm the Chief Development Officer at Senior Resource Association as of this past July. And given my very short tenure, I've asked Liz if she would give this semi-annual report, but you will be hearing more from me in the future. Thanks.
Fair enough.
Thank you, Robin, and thank you all for another opportunity to share the good works of Senior Resource Association. The 4 questions that were posed to us, we have discussed it in great length, and of course you have some of the information in front of you. I want to start with the 2 learnings that we gained over the last 6 months and how they reinforced or informed our future planning. And as mentioned, SRA has learned in the last few months that there are other public guardian programs around the state that are offering professional guardianship services to seniors who, like those we serve with public guardianship, lack the capacity to make decisions in their own best interest and lack a caring individual, family member or friend, to assume responsibility for helping them with those decisions. But the difference in the public audience and the professional guardian audience is that the public guardianship program serves those who are indigent, as you know, and the professional guardianship services are provided to people who share the same challenges but have the resources to pay for services, for guardianship services. So, in learning that there are other organizations around the state that have begun to supplement their public guardianship budgets with professional guardianship paid services, we have, with our board's approval, ventured down that road. And I'm delighted to share with you that just this week we received our registration from the Office of Public and Professional Guardianship, which is a division of the Florida Department of Elder Affairs. So we are now in a position, with all of the background checks verified again and the registration in hand, to within the next few days, petition the court on behalf of a woman who, I'm going to share a little bit about her journey. It began with a silver alert back last holiday season, and she has been hospitalized since January, once located and safely recovered. She's not able to be discharged because she doesn't have the capacity to care for herself, to make those life decisions, to live safely, to manage her well-being and her finances and so forth. So she's not been able to be discharged from the hospital since January. So she will be our first petition for professional guardianship, and we fully expect that the court will deem her incapacitated and assign her to us. So we're very excited to be able to supplement the funding we need for the folks who count on us for public guardianship, but it also really opens up a tremendous window for us to help other seniors. There are so many folks who are isolated and who have no family members and are stuck at home and who decline, and they don't have anybody to help them when they reach this point. So it really is such a natural fit for Senior Resource Association. We're very excited about moving this forward, and we'll keep you posted on our progress as things go forward, but that's exciting news. Also, we shared with you that during the last few months, we've known that there was a growing wait list with the Area Agency on Aging, tongue twister, growing wait list for folks who need in-home supportive services. But through the pandemic and in the subsequent couple of years, there still have been so many people that needed nutritional support, and that basic need, feeding people who are hungry, took priority for SRA. Now, with the compassion and generosity of the district and with the cooperation of so many other smaller funding partners, we have been in a position for several months now to take care of all the people on the Area Agency on Aging's wait list for Meals on Wheels. So we're in a place now where people are eating, people are receiving the food they need, and we've been able now to turn our focus to the folks that need in-home supportive services. It breaks my heart to tell you there are 567 people on the wait list for in-home services. And it's basic things that we all probably take for granted. Light housekeeping, keeping the bathroom clean, respite, companionship, things that keep folks at home connected and provide them with help putting clean sheets on the bed, the little things that we don't think about that folks are unable to do, helping them with laundry. So we're very excited to have a new funding partner that is helping us to get this program off the ground. And it's an individual that we've been cultivating for the last few years, and provided access to a private foundation that is helping us start that program. Our case managers are going to begin by reassessing the folks on the wait list, because some of them have been on the Area Agency on Aging wait list for many years. And it does appear that they would never be likely to receive services through the funding streams that are, they're just, the funding's not available through the government funding stream. So without our intervention, we don't think many of these people would ever get the help they need. But reassessment is required to determine what it is they need today and how we can best meet those needs. And so our case managers, who are specialists in senior services, are doing those reassessments, and that's where we'll begin. And then, again, we'll report back on how that program grows, but we're very excited about that.
You did a Venn diagram. Is there an overlap between those 500 people in AAA's list and the 700 people you're serving? Or are they complete? Are some of them getting food?
So some are getting food.
So you know them, but
we do know them, and actually, our volunteers in doing the daily visits probably report some of the same issues that have been reported to AAA, but they just don't have the money to take care of them, and it's so it's an exciting time, and we expect that program to grow, but we're going to manage it, pace that out in a manageable way so that we make sure that we don't go too far too fast.
Good news that you took care of the wait list for the Meals on Wheels. That
we
was year after year after year, we talked about that wait list. So.
And we are so excited about that, and we appreciate your interest in making sure that those folks were taken care of. The exciting part about it, too, is even though folks continue to register every month, we have been able to manage through those as well. So we're really staying abreast of the ongoing demand, and it's a wonderful position to be in. We've not been there in quite some time, so we're grateful for that. Any other questions about that initial learnings question that was posed?
Liz, I celebrate that you're looking at diversifying the revenue for the public guardianship program. Thank you for going out there and finding that.
Well, credit to my colleagues, because they have kept their noses to the grindstone and their ears out there listening for opportunities. So I will pass that along.
Please.
Okay, so the next question was, what did not work as planned or anticipated, and how will we use this information in the future? And I think probably the greatest challenge has been, every challenge presents an opportunity as well. The continued recruitment of volunteers in order to support the delivery of all these meals to all these individuals that have been counting on us, waiting on us, and now counting on us, that is an ongoing challenge. And so we have tried to get creative in that process. We do allow our staff, with approval of their managers, if they wish to, they may volunteer to drive a route. And we have had a number of folks that have taken advantage of that, and seems to be working well and keeps them connected to the mission. One of the things that some very wise ladies advised SRA to do some years ago was to build a culture of philanthropy. And this certainly absolutely underscores and reiterates the need. We're all in it, all heart in it, but when you see it, right there, and you're driving and you're talking to people, makes all the difference in the world. So that's very important. Another thing we've been able to do since during COVID, and it has continued since, the Federal Transportation Administration has provided funding for services like our community coach to be used to deliver meals. So we are actually using our community coach drivers, and I drive Meals on Wheels, and so I frequently, when I pull in on my Thursday route, I see the bus there from Community Coach, and they're loading in their meals to go as well. So it's fun to see that they get that opportunity to see people that they're serving differently. And also it's a great use of funds that are available through that special funding source. And then lastly, we continue to just drive our marketing and outreach activities to try and recruit more individuals, more companies and clubs to do Adopt a Route through churches and so forth. So we are really just trying to get the word out there for
How
that.
many drivers do you need on a daily basis, Monday through Friday?
So we deliver around 600 meals. Let me think about it if I know. There's probably 40 routes or so between Sebastian and Vero. I don't know the exact number, but yes. And yeah, so it's an ongoing need. And you know, the thing about, so our drivers, many of them are seniors as well. And so they take breaks for health issues. They go up north or wherever they live during the off season. So there is just a constant churning. And so we never rest when it comes to recruitment. I'll just put it that way. Then with the organizational growth that we've experienced, we have divided the responsibilities of our senior services between two senior managers. We now have a director of Day Away, Meals on Wheels, and volunteer oversight. And then we also have a director of case management, public guardianship. That covers, of course, the in-home services we were just talking about, information and referral, durable medical, and emergency alert. And I don't think I missed anything, but so we've divided those two because it is quite a bit of responsibility to keep track of all of those. So those were two things that happened in the last few months. Emerging issues. Obviously, we are extremely excited about the VCOM proposal and where that is going, because we know that for years now, locally, statewide, and nationally, physician shortages have been a tremendous problem. So we're enthusiastic about what will happen with that partnership, and hopefully the growing some medical professionals, homegrown, that will benefit our community. And then, of course, affordable housing is the other issue that we all worry about. So, as far as the most striking difference in our organization in the coming 5 years, we just expect to see continued growth. And, you know, we've talked about the public guardianship program and how much it's grown since we were asked to assume that in 2019. Just this year, just in the last couple of months, we've been asked to assume the programs of the Senior Collaborative of Indian River County. And so effective October 1, we will take on many of those. When I prepared this report for you, we weren't sure of the status of the Upslide program, so it was not included in the report, along with the navigation and the referrals and so forth. We will be doing Upslide as well. It is located at UP, United Against Poverty, and our congregate meal site coordinator is going to be located there as well, so that we will have a presence there, and that will give us an opportunity to continue to help enroll people. I'm pleased to hear that it moved from the North County to a more central location, because there were so many residents that were unable to access the location at the department. So that is a really great opportunity.
So the Senior Collaborative is being disassembled?
Yes, it is. Yes, it is. And so I guess I assumed that you all knew that. I apologize. So yes, the senior collaborative, as of October 1, some of their services will come over, and Senior Resource will be providing those. The navigation, managing the website, the Senior Expo, and maintenance of all the various community resource services that are provided there.
So the funding that we have in our budget for the senior collaborative
Is for the Upslide program, I believe.
is for the Upslide program, exactly. I guess my question is, should we be moving that over to senior resource, assuming that the program is moving to senior resource?
I can inquire about, I mean, I know that it's effective October 1. I can get more
I think
information.
Frank needs to have a conversation with Dawn and understand that.
Yeah, well, first, let me just share a couple of things, because I was looking at Jenny. We weren't sure, I knew about this. I didn't know when it was going to be public. So I didn't, I just, no, that's okay. I didn't know the date, but we have had, conversations about this. Can you speak to, from the senior collaborative side, the
And
Upside?
I'd like to understand why they're, what happened with that.
Can you speak to that, Jenny, or no? if you don't know?
Yeah, I mean, I only learned of it as Liz had mentioned it, and then
Okay.
I spoke with Dawn Redstone, who informed me that it was going to be disbanding. So, and then I contacted Karen, and we had a discussion as well. It sounds like they're going to be disbanding, and then we're going to have to, kind of similar to the public guardianship program that we did, we have to transition to the new organization. So it does go into effect, I think October 1 is what you said.
Yes.
So it kind of fits right in. We will just probably have to do a vote to transfer
Right.
the
35,000, I
funds over.
believe.
35,000.
That's correct.
Yeah.
Well, so, I mean, we need to do that at an October meeting.
As
Yeah.
we speak.
Yeah,
Excuse me?
The I am the chair of the senior collaborative.
Okay.
And so the press releases have all been prepared, and the funder notices have all been massaged, and because it's not for another 12 days, we've been trying to do this in sequential order, so my apologies. We have had conversations about how this will be arranged. There is a work plan that has been in existence for about a month. When we recognize that it is not sustainable over the long term, because it has been entirely reliant on philanthropy, and there's a lot of competing organizations. And so we looked for an appropriate partner that could continue on with the work that's being done. And so we involved Karen and said, is this possible? Okay.
It's a natural, I mean,
is
it's a natural fit.
Absolutely, and
And-
there's been some questions and concerns from the philanthropic community right along, more recently about, is this a duplication of services? Why does it say senior collaborative when it's really, we all know it's a program of SRA, and it's, it just got to be very convoluted. And so this will clarify a lot of things, but because the senior collaborative has been in existence for almost 6 years, it takes a lot to now inform 160,000 people, some of which have been here a very long time in the county, and some have just moved in. So we are working on that, and we will be closing up the official version on October 1st. But we understand that we need to transition over the next month or two, and certainly we'll still be involved to make the Senior Expo that takes place each spring a success. A lot of work has been done on that. So it's really more of a, dare I say, merger than it is closing the senior collaborative. We know how important these resources are.
Absolutely.
Okay?
Thank
Sorry
you.
to jump in.
No, I'm glad you jumped in. I'm so glad you jumped in. Thank you, Vicki.
It's okay.
Okay.
Is SRA absorbing Dawn? Or what's,
Not to my knowledge.
No.
Has taken a position in another firm,
okay,
which is very excited to gain her expertise.
sure. Okay.
So I would say that probably in October, you need to come back if you're expecting funds to shift from the new budget. You'd have to do that at the meeting in October.
Okay. So
Okay.
noted. Thank you.
Yeah, I think our discussion was that we were waiting for the final dissolution forms, like the format that we did with public guardianship, so we had a paper trail of all of the proper dissolution.
Which you should have by then,
Yeah.
by the October meetings. Oh, Okay.
Thank you. Any other questions?
Oh, that was a,
If I could just share one just a little personal tidbit. So today, I drove my Meals on Wheels route, and 3 out of the 7 stops that I make, I have 8 seniors on my route. 3 of them made me think of the hospital district today. One was a couple that has been on emergency Meals on Wheels. The husband has cognitive challenges, and the wife had been not well. She handled all the cooking and everything. And she said today, this will be our last day receiving Meals on Wheels because I am well enough to cook now, and I want to thank you for your service and invite you to help someone else in need. So it made me think of you. And then I had another lady on my route who is going into the hospital, and so she too was like, well, you know, what will happen while I'm away? And I was like, you know, your meals will go on hold, and then when you come back, they'll resume. She said, I don't know what I'd do without Meals on Wheels. So you were in my mind all day today. And then lastly, as related to this most recent conversation, one of the ladies I delivered to was in tears today. And so she needs something like Upslide. So I put in my notes her challenges, and, you know, it goes into the system. And then I sent a text to one of my former colleagues to let them know that you know, I just think Meals on Wheels is such a wonderful program. It really opens a window into their lives, and can't thank you enough for helping us do that. Thank you.
thank you. And happy belated birthday.
Thank you. My entourage and I are going to go to dinner.
I understand. I understand. That sounds good.
Thank you all so much.
Thank you. Thank you. In unfinished business, Frank did talk to you about the VCOM lease, and there apparently was a big misunderstanding or screw-up, or however you want to put it, as far as the date relative to the medical school, right? Relative to that. And the accreditation folks called them and said, saw this, and you can't do that in that amount of time, and that needs to change. And so we had a meeting with them yesterday, and that's when I asked Frank to send that out to you guys to see if everybody agreed to it. Pretty important thing, because they were going to pull accreditation.
Yeah.
Okay. So I would like to, if somebody would make a motion to approve changing that one date in the lease, so that we can move forward.
Mary Beth, can I just make one comment? It's kind of just like a Scrivener's error.
Right.
Doesn't change the intent of the document by any means. Legally, we would call it a Scrivener's error. That's all it is.
All right, I didn't know the legal.
In the non-legal world, it's a typo.
Second.
Right.
Okay, all in favor of doing that?
Aye.
Aye.
Okay, thank you very much. We'll clean that up. Paul, we did discuss your
Yep.
issue. Are we good?
We're good.
Okay, any other business from trustees? Any public comment? Okay, hearing none, we will adjourn the meeting for the month of September. Thank you.